What's up, GBC CNA students? We're going to be over here talking about the reproductive system. All right. Yeah, my name is Michael Ordaz, and I'll be guiding you through my PowerPoint here. The first thing we're going to talk about is the structure of the reproductive system, and I'm going to talk about key points that go towards actual reproduction. So the key parts. So the ovaries, that's where the women's eggs are stored. And they're born with their eggs, unlike male counterparts, where they are producing them from puberty. The fallopian tube, which connects the ovaries to the uterus, and obviously the vaginal birth canal. I'm going to go over the menstruation cycle. So the first phase is a follicular phase, and this phase is stimulated by the natural hormones produced by females. And then the fertility phase is the short phase where a woman can actually get pregnant. And if she doesn't get pregnant, she'll go into the luteal phase. So the luteal phase are follicles that secrete progesterone, and they stabilize the uterine lining. So if she's not impregnated in the fertility stage, you move into this stage, and then from here you'll start your menstruation, where that unfertilized egg will be pushed out of the body. I'll go over the male reproductive system. Some key parts that have to do with the reproduction would be the prostate gland, the testes. So the prostate gland creates a fluid-like substance that helps the semen be transported. The testes, that is where the sperm are created. And the ejaculatory duct, along with the vas deferens, is where that semen is transported through the urethra and out of the penis. Some hormonal regulations. So this is the makeup of a sperm cell. So you got the head, different parts of the body, the mitochondria, the tail. So puberty in teen boys usually starts from 9 to 14, give or minus a few years. Testosterone is created in the testes, and it has continuous production. Unlike females, where they are born with their eggs, the males will create sperm for the majority of their life after they hit puberty. Meiosis and sex determination. So the male sperm determines the sex of the baby. They can either carry an XX or XY chromosome. So this guy, he obviously had a lot of children. So he had 10 wives and 98 children, along with 568 grandchildren. So he was a lifetime producer of sperm. So the amazing race. So if you're talking to me now, you won that race. So anywhere between 40 million and 300 million sperm. All right. And you're that one.
So what are my risk factors?
It's funny you ask. Come on this way, I'll show you.
Oh, yeah, we'll try.
So it'll be age, tobacco use, obesity, sexually transmitted infections.
And what the heck is that?
Oh, funny you ask. That can cause permanent infertility.
Ependymitis.
And also, there's pelvic inflammatory disease. That's for women. But these are risk factors that can affect
women.
So that'd be PCOS, irregular menstrual cycle, and low body weight. The risk factors for men are hypothermia with excessive heat. Hysteria. You gotta keep it cool.
Varicocele?
Yeah, that's the one. Anabolic steroid use, which could shrink your testicles, and occupational exposure. Maybe I work with lead. All right, so age-related changes could be menstruation or the birthing age. Menopause, maybe you get a little hot flashes, or things like puberty. Prostate enlargement. So as a guy gets older, from the age of 30, every year his testosterone drops 1%. Oh, well, towards the end of the game, things aren't just as hard anymore. A lot of older men suffer from erectile dysfunction. Some common disorders in females would be vaginitis, endometriosis, and polycystic ovary syndrome. Some common disorders in men will be benign prostatic hyperplasia, erectile dysfunction, which we just spoke about, testicular torsion, and some important information. You want to make sure you're observing your patients, make sure they're keeping up their hygiene, and making sure you're giving them the preservation of their dignity. Another thing for females is any female past menopause, if you see any vaginal bleeding, you should immediately report that to your nurse. For males, they're going to have a lot of them going to have a lot of trouble urinating or getting that drip out. Obviously, perennial care, keeping up with that for both males and females. And uncircumcised care, I know we went over in class, but you want to make sure you're pulling the foreskin back and cleaning thoroughly, and then also catheter care. But thanks for watching.